Now, going over some of the other questions that we had from last week, what can we do for breathing? So I'm going to get over into my my teaching slides, particularly a couple different ways. So let's talk about what we can do for breathing. I'm going to focus a little bit of it on asthma, but I also wanted to just kind of review, breathing and COVID and some other things. So, or long haul and response. So one of the best things that we can do for breathing is to well, let me just start. There's a B phospholipid, so vitamin E number 2. Vitamin E2, like they hardly ever talk about it in medicine, actually helps to carry oxygen throughout the body. So the FDA didn't like the terminology of E2, so they stopped, calling it a vitamin. It's one of the vitamin cofactors. It's a beef lipid extract. It's something that you can take orally. It helps the red blood cells to carry oxygen. Other thing that we can do with breathing problems is to give some ground up cow lung. It's associated with protemorphogen therapy. Protemorphogen therapy is the smallest blueprint of cellular assembly. It guides the tissues in how they can repair. Protemorphogen therapy, ground up cow extract, cow lung extract, is really helpful for rebuilding industrial exposed lungs, like toxicity or smokers' lungs. But I've seen it pretty good with COVID long haul. So vitamin E2 and something called Pneumatrophin or lung rebuilder. There's some other considerations if it's not COVID associated. Like I really like physical therapy. I like massage therapy, chiropractic therapy to basically come in through the back, and help the lungs as they do these C's around from the spine to the front of the sternum. So that protective rib cage, it's around the lungs. Sometimes it gets jammed up. It doesn't move as well as it's supposed to. So some type of mobilization therapy. Of course, as a chiropractor, that's my favorite. I've seen a lot of massage therapists get relief. I've seen some modalities that you can do in the physiologic therapeutics realm with diathermy and laser and electrical stimulation and some of those things, but there's a mechanical component associated with that. Then there's some asthma component. I wanted you guys to know about this because asthma is there's a lot of opportunity to improve asthma. And so I just wanted to go through this little program. Asthma, it's a disorder of the respiratory system. And if I'm not making any progress with COVID long haul, I'm going to jump over into this asthma because I've had not a little good outcomes. I've had absolutely fantastic outcomes with asthma. So it's a narrowing of the breathing pathways for coughing, sneezing, cardiac asthma. You get some buildup. I'm really not talking about that, but there's a lot of people that have asthma, 17 million, 5 million at the age of 18, 5,500 deaths per year. So, literally there's almost 20 deaths a day of asthma, and it's increased by 60% between 1982 and 1994. Now, I haven't seen anybody like explain to me why that is. Is it we have a more toxic environment? Are we getting better at diagnoses? Is there some other thing that's causing that increase? But when you have an asthma attack, the airway pathogens restrict, and then it's like you are creating all this lactic acid and pyruvate, which we know at a cellular level, what happens is if oxygen is the electron acceptor in the electron transport chain, which is one of the biochemical processes, the byproduct is oxygen, it's fuel, and it's water, and a little bit of carbon dioxide. Now, if we don't have oxygen in the body, what happens is it turns to lactic acid and pyruvate, which poisons the system, and it makes it so it doesn't work very well. Well, when you have a narrowing of the pathways from an over responding immune system, what happens is now we go into that same pathway. And so there's some environmental triggers, food allergies, exercise induced asthma, infections, which I think it just causes so many different things, adverse or accidental impact from medications, cold weather. And one of the most frequent causes, in my opinion, as I see the reaction to some immunizations and some childhood asthma, is one of the biggest reasons for pediatric emergency room visits. And so asthma, there's 5 times greater, incident, according to a New Zealand study. And the medications for that, bronchodilators, epinephrine derivatives, corticosteroids, And so the treatment considerations for that, I like doing a detox therapy and getting the immune system to calm down. So asthma is an overreaction of the GI, or excuse me, the immune system. So this stimuli comes in. If I walk out into a field of ragweed pollen, I don't have any allergies. So I'm breathing, my immune system sees that pollen and it's just processing it. I go there with my wife and she'll be like, oh my gosh, my eyes are starting to run. My nose is running. I'm not as breathing as well as I'd like because her immune system is over responding. I love one of these things, Asthmatica from the company called Complemed. I like adjustment therapy. I like acupuncture for those considerations. A couple other different medicines inside the office that will get summarized for you. But let me tell you about one of the neatest things for COVID long haul and for asthma and for respiratory distress and for chronic obstructive pulmonary disease and for, lung problems, called the infraspinatus respiratory reflex. So I'm just excited to share this with you. It is, let me just go back to that. Okay. It was developed by Dr. Harold Philibert, who is a medical doctor in Louisiana. I learned this through Dr. Schellenberger, and all these doctors have had impact on learning how to really help lung problems. But he noticed that he could get nearly 100% improvement so excuse me, he noticed 100% improve tenderness. So Jordan, slide over here or turn around on so I can see your back. So I'm going to show you guys, like, here's Jordan right here, a fine physical specimen, if I must say so. But here's his clavicle right here. You can feel the spine of the clavicle. Right underneath that, he's got a muscle here called the infraspinatus muscle. And he found that people with breathing problems, I found this too, like when you start palpating on this muscle and this muscle over here, it's really, really sore. And then he decided, well, what can I do to make it less sore? Thanks, Jordan. And what he found out was that if he went and he reset those muscles, he can really make a difference on breathing. Now, I've taught parents how to do this with kids. Like you can go in there with your thumb, or you can go there with the end of a pen like this. So you don't want to obviously break the skin, but if you push on this into that muscle and reset those trigger points, there I've seen some improvement in some patients with breathing problems. And so how that works is because the autonomic nervous system regulates body functions, control breathing rate, heart rate, perspiration, dilation, etc. Once that muscle gets irritated, the front part of that nerve, basically goes to the spinal cord and it interferes with the reflex for breathing. And so this is kind of how the autonomic nervous system works. You have the stuff coming out of the brain, down the spinal cord. You have these nerves that go out to the eyes, the heart, the lungs, the stomach, and it's on autopilot, but it is directly influenced by this reflex. And so some of the, problems or complications with some of the common prescription drugs, that steroid or that epinephrine stuff, it has some undesired side effects. And so when we can go in there and find that muscle, and I'll show you a little diagram in a minute, you can really help respiratory problems. It's simple. We use an injective procedure, but I've showed parents how to strip that muscle, massage it and take the end of a pen and some other things with a lid on, and you really just want to work on that muscle. So he found that clinical studies on a series of over 4,000 patients, 85% of them he was able to significantly improve, and 50% it just completely gone away. And I've seen some really good statistics, probably close to the same. I haven't kept exact numbers on it because I treat people and they start to breathe better, and there it goes away. But it's really helpful for cigarette exposure, environmental irritants, inhalants, allergens, mold, food additives, and results in this irritation. So I just want to get right over to how to reset the muscle. So one of the things to evaluate people, you have them lay on their stomach, you get their arms straight out on the side of them, and you can palpate or feel that muscle underneath that hard ridge that's called the spine of the scapula, right underneath it, going towards their feet, not underneath it, but just down from that. And if you start palpating that muscle, a lot of times you'll feel your really sore spots. And there's what the muscle looks like. It's the infraspinatus muscle. It's part of the rotator cuff. It goes from the medial border of the scapula. It kind of goes across behind and around and wraps into the shoulder. And then there's all of these muscles, that nerve that comes with it. The suprascapular nerve is the nerve that goes to that muscle. The front part of that whole, ganglia and everything goes to the lungs. And so sometimes just adjusting that C5, C6 area helps. But here is that what that muscle looks like. Now, obviously, we've taken away some other muscles that and some organ, but this is what it looks like. So you find kind of the wing of the scapula, you find the spine, and you can find these sore spots in there. And a lot of times, 2 or 3 treatments going in here and injecting those, or taking your pin or some kind of like blunt object, but in pushing on those and getting those muscle fibers. So muscle fibers are supposed to slide on each other like this. And sometimes they get irritated, they lock. And if you push pressure on those, this is called, release therapy. What happens is they'll open, and all of a sudden that nerve impulse starts to get better. So any breathing problems, really, really exciting. You guys should be aware of that infraspinatus treatment.